when I started Reform Medicine 13 years ago, one of the visions we had for it was we need a place where patients will feel safe, providers will feel safe, and staff will feel safe. It'll be a gratifying place to work, and everybody will come here and go, yes, this is what it's really supposed to be like, right? I mean, that wasn't a direct pay, cash transaction type of thing. We're gonna have accessible, affordable, effective health care, and everybody who does it is gonna think it's great because we're gonna figure out the model that gets everybody paid fairly and feels different and doesn't burn people out. The second thing, one of the things that we do is I'm also, it's not strictly a board certification, I'm a diplomate of the American Board of Obesity Medicine. So we do a ton of, that's a bad pun, we do a lot of obesity visits. We follow about 350 patients a month for obesity, and have I would say it's world-class results. And so that when you bring on a new employer, when we get an employer who comes on board with us, the first, depending on the size, but the first 20, 30, 40 patients who are going to schedule appointments are those people who've been looking for a really effective way to treat their overweight status, and the big systems kind of have run away from that, or they just defer them off to the dietitian, and as Marty was saying, they usually get bunk advice and never really lose much weight. But we really lean into that at Reform. That was something I was doing at Mayo for a number of years before I left there. And so when you put that primary care and an incredibly effective weight loss strategy together, and you can start pulling people off of drugs and see their IBS and their asthma and their arthritis and their eczema and all these things you don't think of as diet-related problems get better, man, that is just a cool thing. That's a lot of fun. It makes primary care so much more easy.